All right, hey everybody. This is Eric, and today we will be covering mental health for our high school health lesson. Hope everyone is doing all right. This is my first time doing the screen record and the video this way, so hopefully we don't have any problems. So what we're going to cover um, is mental health again, and we're going to cover various aspects, also definitions and things like that. So to begin with, this is going to give us an idea for today. Again, discuss the meaning of mental health and what aspects does it cover. Examine some risk factors of mental health. We will identify the most common mental health disorders. We will examine early signs of these disorders, and we'll finish the lesson with a review, or not a review, but reviewing the treatment options. All right, so the first thing we would do in the original class setting is we would talk about the definition of mental health. I think every one of us has our own viewpoint, way of seeing it, way of understanding it. And there's a software that I've actually used before where you can ask the students to insert their own definition. And at this point, I would say keep it within 5 to 6 words to be able to get a base definition, a short, simplified definition of what they think mental health is. Then when they submit it, it'll be uploaded to a word cloud, which will emphasize words that are more used than the others. And so we'll be able to get an idea of a classroom definition of mental health. But as far as medical news today, mental health refers to cognitive, behavioral, and emotional well-being. It's all about how people think, feel, and behave. People sometimes use the term mental health to mean the absence of a mental disorder. That's not exactly true, as we'll see later on in the lesson. And then the World Health Organization, or commonly known as WHO, especially in times that we're living in today, states that mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to contribute to his or her community. So looking at mental health, some generals about mental health is that it can affect daily living. It's not always, as we mentioned in the previous slide, it's not always there being something so severe. It could be minor as well. Affecting relationships and physical health. But also this connection can work in a two-way direction. So for example, factors that may influence daily living, relationships, and physical health, it can go the other way. Though all those things are interconnected, it can also have an effect on one's own mental health. So it's like a coin that goes both ways. Looking after mental health can preserve a person's ability to enjoy life. Doing this involves reaching a balance between life activities, responsibilities, and efforts to achieve psychological resilience. Conditions such as stress, depression, and anxiety can all affect mental health and disrupt a person's routine. Although the term mental health is in common use, many conditions that doctors recognize as psychological disorders have physical roots. So again, that's what we're talking about. It goes both ways. When we go back to talking about some of these organizations, these are the governing organizations around the world whenever it comes to mental health, because it's such an abstract topic. But the WHO states that mental health is more than just the absence of mental disorders or disabilities. Peak mental health is about not only avoiding active conditions, but looking after ongoing wellness and happiness. So it's not just about a condition that may appear in your life, but it is also about a continuous wellness, happiness from day to day. They also emphasize that preserving and restoring mental health is crucial on an individual basis, as well as throughout different communities and societies all over the world. But here in the U.S., the NAMI, or the National Alliance on Mental Illness, concludes that about 1 in 5 adults will experience mental health problems each year. And I believe our population is somewhere around 300 something million. So you can get a general idea. 3 years ago, they estimated that 11.2 million adults in the US, or about 4.5% of adults, had a severe psychological condition. And that was the NIMH, which is the National Institute of Mental Health. So what we're looking at is basically risk factors for mental illness, negative mental health. And basically, it doesn't exclude anybody. You can be 15, you can be 25, you can be 45. And at some point, there's a risk factor for every single category of sex, income, ethnicity, or age. In the US and also in other developed countries, mental disorders are one of the leading causes of a disability. Social and financial circumstances, biological factors, lifestyle choices, all of these things can shape and affect a person's mental health. A large proportion of people with mental health disorder have more than one condition at a time. So it's a good thing that we look at the delicate balance of factors and several elements of life that, in general contribute to these disorders. So for the following risk factors, we'll be examining continuous social, economic pressure, and biological factors, which are divided into two categories. The first one is social economic pressure. What this means is having a limited financial belonging, also meaning that it could be marginalized. A lot of times we see persecuted ethnic groups, which can lead to an increase of the risk of mental health disorders. In 2015, there was a study done in Iran about 903 families that all identified several socioeconomic causes of mental health conditions. And these all range from poverty and living on the outskirts of a large city. The researchers also explained the difference in the availability and quality of mental health treatment for certain groups in terms of modifiable factors and non-modifiable factors. And so we'll see what those look like on the next slide. So modifiable factors, which are ones that can be changed eventually, and non-modifiable means that they ultimately can't to a certain degree. So looking at modifiable factors, there are socioeconomic conditions, what work is available around you, what jobs, what occupations are available to and accessible to you, what is your own level of social involvement in your community, in your city, in your town, what is your level of education, and to what degree of housing quality do you have. Those are things that can change and be influenced in the future. Non-modifiable factors include gender, age, and ethnicity, which are pretty explainable down to the point that you're either who you are and, your age doesn't change and you can't go back on that. Your ethnicity, you can't just change that either, which will put certain people in worse economic and social points of having mental health disorders. The study goes on to list gender as modifiable and non-modifiable factors, and the researchers found out that being female increased the risk of low mental health status by 3.96 times. So we see that the female gender is at an increased risk when compared to men. Now we're looking at the biological factors. Again, talking about the NIMH, they suggest that genetic family history can increase the likelihood of mental health conditions. There are certain genes and gene variants that put a person at a higher risk, although not everyone will agree or find this conclusive. Having a gene that links to a mental health disorder, such as depression or schizophrenia, does not mean that that condition will develop in that same person, or a person of their seed. Likewise, people that go without related genes or family history can also have mental health issues, so it's not conclusive. Mental health conditions such as stress, depression, and anxiety may develop due to underlying and life-changing physical health problems. These could include cancer, diabetes, chronic pain, you name it. So some common mental health disorders are going to be anxiety disorders, which are the most common, mood disorders, and then schizophrenia disorders. And so as we're going to look through these, we're going to examine some of the anxiety disorders and mood disorders. But schizophrenia disorders is the highly complex disorder. It's also a highly complex condition. There are signs of schizophrenia typically developing in most people between ages of 16 and 30. And people or researchers, scientists aren't exactly sure if it fits into its own category or if it could be related to some of the others. So going back to the general disorders, anxiety disorders, there is the GAD, and it's a common worry that disrupts everyday life. People experience common things such as restlessness, fatigue, tense muscles, and interrupted sleep. And this would be something that happens continuously, maybe not just a day or two. Another one is panic disorder. People with panic disorder can experience regular panic attacks. This could be sudden, overwhelming terror, feeling, sense of imminent disaster and death. Whether or not it is going to happen, people will get that overwhelming panic attack. Then there are also obsessive compulsive disorders, OCD. People with this will have, like, as the description fits, obsessions and compulsions, which means that they'll have thoughts and powerful urges to do acts over again, such as hand washing, or somebody putting on Germ-X constantly, or somebody brushing their teeth constantly, more than what should be common. Simple phobias are also anxiety disorders, and these could be disproportionate, or they could be common things that we hear, such as fear of certain scenarios, animals, like snakes, and I put on here fear of spiders is a common example. Then there's social phobia, sometimes known as social anxiety, and this is a fear of being subject to the judgment of others. So it's about being pressured by your peers, people you work with, family. People with social phobia will restrict their exposure to the environment. So they look forward to not being around other people. Then there is agoraphobia. This term is a fear of a situation in which getting away may be difficult. So some common examples would be being in an elevator, afraid of it getting stuck, or a train that could get stuck in a bad position and the exit's not working, or like an airplane would be another good example. Then there is PTSD, which is post-traumatic stress disorder, and we associate this a lot with people who are in the military in any of the branches. But it can occur after a person experiences or witnesses a deeply stressful or traumatic event. During this type of event, that person going through PTSD will feel like they will feel the same feeling that they felt whenever they were in that situation before, almost like a sense of deja vu. They'll feel either afraid, they'll feel regret, remorse, almost like they don't have any control over what's happening. And this all contributes to PTSD. Mood disorders, there are three kinds: major depression, bipolar disorder, and seasonal affective disorder, also known as SAD. The major depression was where someone experiences low mood and they lose interest in activities and things, events, gatherings that they used to enjoy. Bipolar disorders occur when people experience unusual changes in their mood, energy, and levels of activity, and ability to continue with daily life. So periods of high mood are known as manic phases, while those low valleys are those low mood swings. Then seasonal affective disorder, reduced daylight triggers during the fall, winter, and early spring months, and this will cause this type of major depression that we mentioned in the first one, and it's most common in countries that are far from the equator. Possible signs of mental disorders: withdrawing from friends, family, and colleagues, avoiding activities that they would normally enjoy. Some others are feeling hopelessness, hearing voices, experiencing delusions, being confused. There are various methods for managing mental health disorders. It can be specialized, it can be generalized, and it also can be based on the individual. And some of these treatments are more progressive and successful when they are combined with others. It depends on the person, who's living with a chronic mental disorder. They may choose, one option, where someone who's later on in their life would choose another couple of options. So the individuals need to work close with a doctor. They can help them identify what their needs are and then provide them the suitable treatment. And this graphic here is a perfect example. Psychotherapy is a type of treatment where someone takes a psychological approach to their mental illness. In the diagram or the picture you see on the left, actually shows someone who's revealing their thoughts. They're all jumbled up. You can see the different colors, and that reveals the different tracks of their mind, how it's all raveled together, and they're not able to differentiate between their strands or bands of thinking. And so someone else who is certified, who is able to look at even the smallest details, can help them put all these things in order and relieve some of the stress, the anxiety that they feel in daily living. And they can help people understand where the roots are of their mental illness. So that way they can work on a more healthful thought pattern that supports everyday living. Another form of treatment is medication, which kind of is dependent rather than independent, because you're depending on a certain type of pill, consumable to help you get through your anxiety or mental disorder. So some people take these prescribed medications such as antidepressants or antipsychotics or anxiolytic drugs. Although they don't cure them, they can help improve the symptoms to someone who may be developing mood swings, to someone who may be developing common ongoing depression. And some of these medications work by boosting the body's absorption of feel-good chemicals such as serotonin from the brain. Then there is self-help. A person coping with mental health difficulties will usually need to make changes to their lifestyle to facilitate wellness. And although these changes could be severe or minor, they could include alcohol intake, deciding to sleep more, deciding to eat a more balanced, nutritious diet, and also taking time away from work or resolve your issues with personal relationships. Those around you, those closest to you, family members, spouses, that could cause damage to your mental health. People with conditions such as anxiety, depressive disorder, any of the ones that we've been talking about, can also benefit from relaxation techniques, including yoga, meditation, anything that has deep breathing and mindfulness. And then it's important to have a support network, whether that's you going yourself to check in, whether that's you having an accountability group of friends, whether that's you having family members as well, being open with them. It can be essential to the recovery of your mental illness. And then ultimately, the last thing that we have on here is a suicide hotline. The number is 1-800-273-8255, which is open 24 hours across the nation. So that's what we have for today. If there are any questions, leave it in the comments, and I'll get to it as quick as I can.